So anyone, can you refresh your memory from last week? Hmm,
Coagulation factors, reactions will happen.
What happens? Ovulation?
Coagulation factors, blood clotting factors,
Okay.
uh, intrinsic mechanism and extrinsic mechanism will happen.
Okay. So what exactly happened in these mechanisms? How fibrin forms? Anyone else? Can you all see my screen?
Yes.
Yeah. Hmm, okay. So last time we discussed about certain factors, fibrinogen. Yes, fibrinogen convert to fibrin, but to happen that there are different other mechanisms happen first. Like when there is an injury, the platelets will go there and stick to that. Adhesion will happen. And then the platelets will get activated in the sense they will secrete certain chemicals so that nearby platelets also will attract to that place and then they get together, adhere to one another. And these tumor, there will be some factors releasing, and those factors will stimulate the coagulation factors like 7 to become 7 active 7, and then 9 becomes 9 active. When active factor 7 is there, that will stimulate other factors to become like 7 will induce the activation of 8, and 8 will activate, will stimulate factor 9 to become active. And when factor 9 is activated, that will stimulate factor 10 to be activated. Then factor 10 will convert thrombinogen into thrombin. And when thrombin is present, that will convert fibrinogen into fibrin. Can you all remember that I show you all a diagram and then uh, I asked you all to write it down also at that time, right? So, if we refresh our memory again, although coagulation is loosely expressed as clotting of blood, so when we practically, when there's an injury, we see after few seconds or like within like a 1 minute, the blood will clot in a normal person, right? So we see it as a simple process. I mean, like in very short a period of time, the blood will clot. But actually, inside that, there'll be a lot of things happening, right? So although coagulation is loosely expressed as clotting of blood, the mechanism refers to the conversion of soluble fibrinogen to insoluble fibrin strands in which blood cells get trapped to form a clot, or we call it fibrin thrombus. So fibrinogen is soluble, it is in our blood in a normal any time. But when there is an injury, that will be converted to fibrin, which is insoluble and it's like a strands, right? So if you can imagine like some noodles, something like that. So they will trap the blood cells and make a thrombus or a blood clot. The formation of a blood clot is the last step of a complex coagulation cascade. Involving circulating coagulation factors, the proteolytic enzyme thrombin converts soluble fibrinogen to insoluble fibrin. So anticoagulant drugs are used to reduce the coagulability of the blood. They comprise of several classes of medications like heparins, warfarin, direct thrombin inhibitors, and direct oral anticoagulants. So we are going to talk about hemostasis because we need to understand what is hemostasis and what happens in the process so that we can understand the drugs and their mechanism. So there are several classes of medication when we talk about anticoagulants, namely heparins, warfarins, and there are direct thrombin inhibitors and direct oral anticoagulants, right? So vitamin K is substance that promotes coagulation and is useful in hemorrhagic states, right? So please, pathophysiology and physiology on the coagulation cascade to familiarize uh, with the clotting system comprising of clotting factors and enzymes, right? So since you can't remember, shall we just go through the coagulation cascade? Can you see my screen that I am on Google now?
No, miss.
No.
Okay, let me show. Right, I'm going to stop share and again share it. Okay, I hope now you can see, right?
Yes, miss.
Right? So here, there's the intrinsic and extrinsic pathways. So intrinsic means like when there's an injury happens, so collagen, these certain chemicals will be released which are not normally present. So those will stimulate factor 7 to become active 7. So active 7 will stimulate 9 to become active. And when active 9 is there with calcium ions, that will convert factor 10 to factor 10A. That means active 10, right? And then this thrombin will become hold on for a second. Right? Uh, so this is what we discussed last time also. So when active 10 is there, prothrombin will become thrombin, and this thrombin will activate fibrinogen to convert into fibrin, right? So this is basically it. So this is actually not pharmacology. You should learn these things in your physiology. But since we need it to understand the drugs, I'm just refreshing your memory on these points. Have you all learned this in your physiology?
No.
Right? So, however, this is what happens. Certain factors are becoming active, and these active factors will convert prothrombin into thrombin, and that will convert fibrinogen into fibrin. So, factor 7 and factor 10 plays a vital role in coagulation. Right? So, did you all write this pathway last week? Oh no.
No.
I think it is better to have it in your notebook as well, like in very short summary. Can you all write this down? Because if we don't have this one, it's difficult for you all to understand what's happening. So I will just give you 5 minutes. Uh, so draw this diagram, okay? Have you all finished writing?
Yes.
Done?
Yeah.
Okay, so can we like summarize this again? So factor 7 will get what?
7A. Activated 7A.
And then um, also factor 9 will become activated 9. So those things will stimulate factor 10 to become factor
10A. Activated.
activated 10. So that will basically convert prothrombin into,
Proton.
so thrombin is an
Thrombin.
enzyme which can catalyze or stimulate conversion of fibrinogen into
5A.
fibrin. So fibrin is insoluble. Fibrinogen is soluble. So when fibrin is insoluble, it will be like strands like things. So they can capture the red blood cells and make a blood clot. Okay, is that clear to everyone now? Others, can you all also talk? Is that clear?
Yes, Miss.
Yes, Miss.
So the drugs that act on coagulation cascade, drugs are used to modify the coagulation cascade for the regulation of coagulation and for the treatment or prevention of bleeding. So vitamin K. Vitamin K is a substance that promotes coagulation and is useful in hemorrhagic states. Vitamin K occurs in two forms, naturally in plants and synthesized by gram-positive bacteria in the intestines. So we have natural one and a synthetical one using a bacteria. So vitamin K is important in coagulation because certain, especially factor 7, to produce these coagulation factors, vitamin K is needed and it is important. So they promote the synthesis of the vitamin K, promote the synthesis of factor 2. So factor 2 is actually the prothrombin, and factor 7, factor 9, and factor 10. And there are anticoagulant proteins like protein C and protein S. So the synthesis of these things needs vitamin K, right? So for coagulation, vitamin K is an important component. So if the vitamin K is deficient, the coagulation will not happen properly. So for those people, we will have to give vitamin K, right? The main clinical symptom of vitamin K deficiency is this tendency to bleed. And there are other things like ecchymosis, epistaxis, hematuria, GI bleeds, and post-operative hemorrhage. So bleeding, in the sense, it can happen in different ways. Bleeding, blood can pass through urine, and the gastrointestinal system can bleed. And after operation, it will not clot or coagulate, so the bleeding will be there. So bleeding is the clinical symptom of vitamin K deficiency. Vitamin K deficiency can result from inadequate dietary intake or absorption problems or broad spectrum antibiotic therapy, use of a vitamin K antagonist like warfarin, right? So available as an oral tablet